Hello. Welcome back to Eppa Worldwide, and my name is Mamle Godwins. Thank you for coming back here. I just want to take this opportunity to welcome all our new subscribers and thank you for joining the platform. Today it's a long overdue video. It's a follow-up video that I meant to do for the anxiety that I talk about in children and ways to treat anxiety. Today we're going to talk about specific medications that we use in treating anxiety. I'm a single mother of 2 boys. I am a divorcee. I am a psychiatric mental health nurse practitioner. I am a survivor of parental alienation, and I use this platform to educate people on mental health, parental alienation, and also in my practice, I share with you treatment modalities. So if you're a psychiatric nurse practitioner student, you need a preceptor, you know where to go. I have a Facebook page also that is for my practice, Kara Manual Behavioral Health Services. Kara Manual BHS is the Facebook page. And I have a page on Facebook with the same name, Eppa Worldwide. Eppa Worldwide is where we talk about abuse, trauma. As a victim, as a survivor, I owe the community and social change a lot of change and education, advocacy, and raising awareness. So I talk about violence against people. Both men and women go through violence in marriages and relationships. I talk about trauma. I talk about overcoming trauma. I talk about pretty much life, things that affect us that is not appropriate. Social injustice, yes, I talk about all those things. So if this is a content that you would like, kindly subscribe to my channel, kindly turn on the notification, and whenever I put a new video out, you will be one of the first people to grab it. Okay, so today we are talking about treatment for anxiety. How do you treat anxiety? There are different approaches. The first approach is somebody who gets anxiety periodically, not constantly. Those people, the most effective medication for treating them is benzos. Benzos are medications that are highly effective for people that have panic attacks, that gets exposed to like stimuli that causes them to be very anxious. Like you have a child that you have somebody that sees their abuser, and when they get exposed to the abuser or an animal or a situation that makes them very nervous and anxious or feel panicky, those people are those that you use benzos to treat. Benzos are not meant to be used daily. They are very addictive, can become dependent on them, and so I don't encourage them. I will give them to you if you're already on them, but I will not continue giving them to you if you're already on them, because I'm going to wean you off it and replace it with a more effective drug that can also handle your anxiety and panic symptoms. The main one that many use is Ativan and Xanax, just so you know. The other medication that is not the benzo but is highly effective is Visceral. Like I explained, benzos are highly addictive. You can become extremely dependent on them, and they are not great if you become dependent on them. They are not meant to be used daily. So if you become dependent on them, you become addicted to them, then it means you're going to be taking them daily, and that's why it's highly discouraged for you to go for the benzos. But you treat them with, first of all, you even treat the anxiety with medication. Why? Because you have tried everything. You have tried coping mechanisms, you have tried deep breathing, you have tried being mindfulness, you have tried just therapy. You did everything and it's not working. So you need a backup support for when those non-constant but severe panic and anxiety attacks comes on. That's when you use this category of medication: benzos, Visceral, and propranolol. Propranolol sometimes can be taken daily. It's great and very effective because when you have anxiety, your blood pressure goes up. You have the flight and fight response. Your norepinephrine levels goes up. So you want to use it to calm you down, relax your muscles, the cardiac muscles, and the constriction of your brain muscles to help you relax. So guess what? That's when you take the propranolol, which is highly effective. It helps also with blood pressure. So sometimes I use the approach whereby you are using the same medication to fight two disease diagnoses. So if the patient is have a high blood pressure issue, it's great to use also propranolol, and then also talk to their primary care physician and say, hey, this patient, maybe we can do the we can use this treatment approach so that we can decrease polypharmacy, meaning instead of patient being on cardiovascular medication and also being on the anxiety medication, we're using propranolol to help address both issues at the same time. The other medication that you can use that is highly super effective is hydrocesin, which is also called Visceral. Hydrocesin is super effective. I have used it personally for my clients and I have had great results. However, hydrocesin causes sedation. So if you have those kind of PTSD kind of anxiety whereby patients have a problem, they have the racing thoughts, they have difficulty in calming their brain down with all their PTSD symptoms, and they have issues with anxiety and sleeping, or maybe they wake up in the middle of the night with those PTSD associated nightmares, or even if they don't have PTSD but they have nights they lack the ability to maintain sleep. They can either go to sleep but not be able to maintain sleep. So sleep 1-2 hours, then they are awake in the middle of the night, 1 a.m., 2 a.m. out of nowhere, and they can't go back to sleep. Those people, Visceral can become very, very, very effective for them because it's highly sedative. So when they take it at bedtime, it helps them keep their sleep, together, and it doesn't wake them up so much, or it doesn't cause them to have sleep-related issues associated with anxiety or panic. So that is it. That's the first approach. Understand that the first approach I just finished discussing is for people who have anxiety and panic disorders, but it comes on and off. It's not constant. Those people you treat with what? Benzos, Xanax kind of. You treat with Visceral. You treat with propranolol. Visceral and propranolol can be used daily. Yes, sometimes, but most of the time, these are used for controlling panics that comes on, so like PRN kind of thing. All right, the next approach in treating anxiety and panic disorders is using the SSRIs or the SNRIs. Okay, in this case, you have the anxiety. It's constant, it's daily, it's uncontrollable. You worry so much, you are scared of things so much, life circumstances, it is just there, it doesn't go away. So you need something every single day to treat the symptoms of anxiety, manage it so that it doesn't come on. So it's more like maintenance way of treating it. In this case, you use the ones I just mentioned. The most commonly used IRs are Lexapro, Paxil, citalopram, and sertraline. Those are the 4 main ones that usually get used, and they are very effective. And then for the SNRIs, the ones that are commonly used, we use the venlafaxine and the duloxetine. These 2 medications as the category of SNRIs that are commonly used and super effective. Reason why these are effective is the flight and fight response goes on in your brain, and it's mainly it's coming from your neurotransmitters, the norepinephrine and the serotonin. So and these are antidepressants. So if you can control and keep these serotonin and norepinephrine levels where they need to be, then it's going to help calm you down every day and put your anxiety levels down, or maintain it where you will be able to function in your day-to-day activities without any stress. So that being said, another medication that can also be very effective in treating anxiety, but is usually not used as the primary go-to medication, is buspirone. Buspirone is highly effective if used with the antidepressant SSIR or SNRI to help provide the synergistic effect. Synergistic effect means additive effect. These 2 together helps a lot in controlling people's anxiety. That is usually not managed just with the antidepressant medication. The final one I want to talk about is gabapentin. Gabapentin is another medication that can be used in treating anxiety, but it is not the primary go-to drug. It is a seizure medication, epileptic medication. And the reason they use this sometimes is that they may have gone to these first ones I described, or this first go-to medication, the first line group that I just discussed, the benzos, basically to manage it when they come on, and then the ones that you use to manage it to prevent them from coming on. So understand, in treating anxiety, there is a category of medications you use to prevent the symptoms of anxiety from coming on. Those ones are what? Benzos. Start commenting. Leave the comment down there. Benzos, Xanax. Example is Xanax, Ativan. The next one is Visceral, which I said it causes sedation, so you can take it at night to help you not to wake up in the middle of your night. And then propranolol, which is also a blood pressure medication that can be used to, it's very effective in treating social anxieties. Like you are about to go to a public event, you have to present like I'm presenting now, you have a panic issues, then you take it maybe half an hour before you get on stage to help calm your nerves down. Yes, so that's what you do. Then you have the category I described, which is the group that you are always anxious. So you don't want the anxiety symptoms to come on, so you can function in your regular day-to-day activities or day-to-day life. And those ones are what? SSIR, SNIR. I did give you 4 examples of SSIR that get used. And that one is what? Paxil, Lexapro, citalopram, and sertraline. And then for the SNIR, the one you use is Cymbalta, and then also venlafaxine. So those are the 2 you use under SNIR. Okay, then we come to the Buspirone. The Buspirone, I talked to you about it. You use it, it's great for, and it's well tolerated by many patients, so you use that also. But majority of the time it is used as in conjunction with the antidepressant, SSIR or SNIR. Okay, the next one is gabapentin, anti-seizure drug, anti-epileptic drug. So you use that as a drug that you have tried all these others and it's not working. Then you use that one. Okay, so thanks for joining. If you haven't subscribed yet by this time, kindly consider subscribing. Eppa Worldwide, yes, this place we teach, we educate, we share personal experiences and also information on mental health. I will encourage you to subscribe, turn off the notification. If you like this video so far, kindly like for me and leave me a comment. Yes, I want to know what you think about it. Let me know if you have any questions and I'll come out and answer them for you. Okay, anyway, I will give you a bonus. The bonus is, what are some of the risk factors that people that put somebody at risk of having anxiety. So some of the risk factors of anxiety in children involves separation, of like divorce, and also chaotic, like uncertainties in their home. If there is a change in their family structure, that can cause a lot of anxiety in children. Academic stresses, school and work-life imbalances causes anxiety in many situations, and that is when you give those people adjustment disorder. You find someone have a generic diagnosis like adjustment disorder. Maybe they are going through divorce, they've lost their jobs, they have problems with academics, they're having issues with academic workload, meeting up with deadlines, stuff like that. Change in their family structure, like I said, uncertainties. Maybe there's a new member, new marriage, family, the father had remarried, mother remarried, or they're going through divorce and separation. All those things can cause anxiety. Increase in adverse childhood experiences, like parents arguing all the time around the children, parents that are alcoholics, parents that have mental health disorders or things like that. These are all risk factors that can cause anxiety. So if you don't know yet, now you know. So you're going to help maintain your home environment calm for your children so that they don't go through a lot of anxiety. That is abuse, trauma, all those things. Chaotic family that has a lot of crisis can increase anxiety in children. Just so you know. Don't forget to watch. There are a lot of other videos on the channel that has to do with parental alienation. A lot of videos on the channel that has to do with parental alienation, targeted parents, things like that. Targeted parents, how targeted parents can cope and not lose their connection between them and their children, and how the alienated parents also operate, like what they can tell your children to gaslight you, bad mouthing you, things like that. So that is what I dealt with, so I use it also to teach, so somebody know it's wrong. It's a crime against the child. It doesn't help the child's development, and it affects them a lifelong. It causes them sometimes to have depression. It can also cause them to have anxiety. So thanks for being here, and I'll see you in the next video. Ciao.